Hello, I am Pharmacist. Today we discuss about second-line drugs for tuberculosis. The second-line drugs for tuberculosis are used when the primary or first-line drugs fail or when the patient has drug-resistant tuberculosis. These drugs are typically reserved for multi-drug resistant tuberculosis, MDR-TB, or extensively drug-resistant tuberculosis, XDR-TB. cases. Here is a list of some commonly used second-line drugs for tuberculosis and a brief overview of their pharmacology. 1. Aminoglycosides. For example, amikacin, kanamycin, streptomycin. These drugs inhibit bacterial protein synthesis by binding to the bacterial ribosome. They are primarily bactericidal and are effective against both replicating and non-replicating Mycobacterium tuberculosis. 2. Fluoroquinolones. For example, ciprofloxacin, levofloxacin, moxifloxacin. Fluoroquinolones inhibit DNA gyrase and topoisomerase IV enzymes, preventing DNA replication and transcription in bacteria. They have excellent intracellular penetration and are active against both actively dividing and dormant bacteria. 3. Ethanamide. Ethanamide is a prodrug that is activated by bacterial enzymes. The active metabolite inhibits mycolic acid synthesis, an essential component of the mycobacterial cell wall. It is bacteriostatic and works against replicating bacteria. 4. Cycloserine. Cycloserine acts as an inhibitor of bacterial cell wall synthesis by interfering with the incorporation of D-alanine into the peptidoglycan layer. It is primarily bacteriostatic and has activity against both replicating and non-replicating bacteria. 5. Linezolid. Linezolid is an oxazolidinone antibiotic that inhibits bacterial protein synthesis by binding to the 23S-RNA of the bacterial ribosome. It is bacteriostatic and has activity against replicating bacteria. 6. Bedaquiline. Bedaquiline is a diaryl quinoline compound that inhibits ATP synthase, a key enzyme involved in the production of energy in Mycobacterium tuberculosis. It is bacteriostatic and effective against both actively dividing and dormant bacteria. Now let's talk about uses of drugs, side effects, contraindications, pregnancy, warnings, drug interaction. 1. Aminoglycosides. Amikacin, kanamycin, streptomycin. Uses. Aminoglycosides are typically used in combination with other drugs for the treatment of drug-resistant tuberculosis, particularly for MDR-TB or XDR-TB. Side effects. Common side effects include nephrotoxicity, kidney damage, hepatotoxicity, hearing loss or tinnitus, and vestibular toxicity, balance problems. Contraindications. Aminoglycosides are contraindicated in patients with pre-existing hearing loss, severe renal impairment, or myasthenia gravis. Pregnancy. They should be used with caution during pregnancy due to the potential for harm to the fetus. Warnings. Aminoglycosides require monitoring of renal function, auditory function, and serum drug levels. 2. Fluoroquinolones. Ciprofloxacin, levofloxacin, moxifloxacin. Uses. Fluoroquinolones are effective against drug-resistant tuberculosis and are often used in MDR-TB or XDR-TB treatment regimens. Side effects. Common side effects include gastrointestinal disturbances, tendinitis or tendon rupture, QT interval prolongation, particularly with moxifloxacin, and central nervous system effects. Contraindications. They are contraindicated in patients with known hypersensitivity to fluoroquinolones. Pregnancy. They should be used with caution during pregnancy due to potential adverse effects on the fetus. Warnings. Fluoroquinolones may increase the risk of tendinitis or tendon rupture, especially in older patients. They may also cause or exacerbate central nervous system disorders. 3. Ethanamide. Uses. Ethanamide is used as a second-line drug for drug-resistant tuberculosis. Side effects. Common side effects include gastrointestinal disturbances, neurotoxicity, peripheral neuropathy, psychosis, and hepatotoxicity. Contraindications. Ethanamide is contraindicated in patients with severe hepatic impairment. Pregnancy. Ethanamide should be used with caution during pregnancy. Warnings. Ethanamide may cause or exacerbate psychiatric disorders. Liver function should be monitored regularly. 4. Cycloserine. Uses. Cycloserine is used as a second-line drug for tuberculosis treatment, particularly in drug-resistant cases. Side effects. Common side effects include central nervous system effects, depression, psychosis, seizures, gastrointestinal disturbances, and hypersensitivity reactions. Contraindications. Cycloserine is contraindicated in patients with a history of severe psychiatric illness or epilepsy. Pregnancy. Cycloserine should be used with caution during pregnancy. Warnings. Cycloserine may cause or exacerbate psychiatric disorders. Central nervous system effects require monitoring. 5. Linezolid. Uses. Linezolid is used in the treatment of drug-resistant tuberculosis, particularly for MDR-TB or XDR-TB. Side effects. Common side effects include gastrointestinal disturbances, myelosuppression, decreased blood cell counts, and peripheral neuropathy. Contraindications. Linezolid is contraindicated in patients taking or recently taking MAO inhibitors. Pregnancy. Linezolid should be used with caution during pregnancy. Warnings. Linezolid may cause or exacerbate serotonin syndrome, particularly when used with other serotonergic dose. 1. Aminoglycosides. Amikacin. The recommended adult dose is 15 to 20 mg/kg once daily, or 10 mg/kg twice daily, intramuscularly, IM, or intravenously. 4. Kanamycin. The recommended adult dose is 15 to 30 mg/kg once daily, or 10 to 15 mg/kg twice daily, IM or 4. Streptomycin. The recommended adult dose is 15 mg/kg once daily, IM or 4, not to exceed 1 gram/day. 2. Fluoroquinolones. Ciprofloxacin. The recommended adult dose is 750 to 1000 mg twice daily orally. Levofloxacin. The recommended adult dose is 750 mg once daily orally. Moxifloxacin. The recommended adult dose is 400 mg once daily orally. 3. Ethanamide. The recommended adult dose is 250 to 500 mg once daily orally. 4. Cycloserine. The recommended adult dose is 250 to 500 mg once daily orally. 5. Linezolid. The recommended adult dose is 600 mg once or twice daily orally or 4. Thank you.